Why swinging arms and shallow squats may help manage internal inflammation and muscle loss. For seniors and those recovering from prolonged illness, the transition from rest to activity is often a delicate balance. Two primary concerns in this phase are sarcopenia, age-related muscle loss, and inflammaging, a term researchers use to describe the chronic, low-grade inflammation that often accompanies prolonged inactivity. 1, 2. Current physiological research suggests that low-intensity, rhythmic movements, specifically purposeful arm swinging and shallow squats, can support the body's recovery systems through several key mechanisms. One, supporting tissue health and circulation. Prolonged inactivity and reduced circulation can lead to a buildup of metabolic byproducts. Breaking this cycle requires gentle, consistent movement to support the body's natural filtration systems. Supporting lymphatic flow. Unlike the cardiovascular system, the lymphatic system lacks a central pump. It relies on muscle contraction and movement to transport fluid. Rhythmic arm swinging supports lymphatic fluid movement, which plays a vital role in immune function and overall tissue health. 3. Modulating inflammatory markers. Regular low-intensity exercise has been associated with lower levels of C-reactive protein, CRP, a key marker of systemic inflammation. While the exact causes are multifactorial, this reduction is likely achieved through a combination of metabolic and hormonal adaptations. 2. Slowing the progression of muscle loss. Systemic muscle loss often involves a decline in neuromuscular engagement, the brain's ability to communicate effectively with muscle fibers. Stability and movement patterns. Rhythmic arm swinging helps manage the body's momentum and balance. Engaging in these patterns can support more efficient and stable walking patterns, which may encourage a more active lifestyle. 4. The role of myokines. When muscles contract, even during light squats, they release signaling proteins known as myokines. These proteins have been shown to influence muscle-to-organ communication and may help slow the progression of muscle loss by promoting a healthier internal environment. 5. Practical guidelines for a safer routine. To maximize the potential benefits while minimizing joint stress, the following adjustments focus on comfort and biomechanical efficiency rather than rigid metrics. The pendulum swing. Instead of focusing on specific angles or degrees, focus on the rhythm and direction of effort. The technique. Focus on a purposeful, relaxed push backward, then allow the arms to swing forward naturally on their own momentum. The goal. Emphasizing the backward motion helps engage the postural muscles of the upper back and triceps, which can support a more upright posture. The shallow squat. In clinical terms, a micro-movement is used to describe a safe, restricted range of motion for those with frailty. The technique. Incorporate a shallow, comfortable knee bend, essentially a rhythmic pulse, every few swings. The goal. For those with joint sensitivities, this shallow range provides the benefit of lower body muscle engagement without the high joint pressure or fall risk associated with deep squats. The relaxed grip. Clenching the fists during movement can create unnecessary tension in the neck and shoulders. The technique. Keep your hands in a soft, neutral position, as if holding a light object. The goal. Maintaining a relaxed grip helps prevent a transient rise in blood pressure that can occur with intense isometric gripping and ensures the movement remains low stress. Summary of potential benefits. Feature. Physiological role. Practical goal. Rhythmic motion. Supports lymphatic fluid movement. 3. May reduce the feeling of tissue heaviness or swelling. Shallow squats. Promotes myokine activity. 5. May help slow the progression of muscle loss. Arm pendulum. Manages metabolic cost of stability. 4. Supports confidence in walking and daily balance. References